Hello, everyone. Happy Tuesday. I did not really promote this um, parent information night as much on social media or in the clinic, so I'm going to do better about that. I had a feeling that no one would remember to come today, but that is okay. We are going to be talking about diagnoses today. Um, in full disclosure, I actually had an IEP growing up for a language disorder, and I was calling it diagnoses for a long time, but the plural diagnosis is diagnoses. So don't make fun of me if I use the wrong term. But this is a common question that we get. So my point in doing all these parent trainings is that the questions that I get at every eval that I can answer it here. And so sometimes I can just point people to this video or like you can share it with a friend because they're probably having similar questions. And if I'm hearing the same thing over and over again, I'm realizing it's a pattern and parents, in the Tampa Bay area need to know what to do because having a kid, especially a kid with any special needs or needing therapy, can be stressful and you get a lot of advice. So I'm just here to help, and last month was about schools and funding and insurance. So review last month, that would be February 2026. If you guys have any questions about that, please feel free to email me. My name is Nicole at BaysideTherapySpecialists.com. Let me go ahead and share my screen. Oh. View. Hi, Joe. From start. Okay, I don't think it's a good thing to share. Okay. So, understanding diagnoses for your child, diagnosis, um, where to go, who can diagnose, and what therapists can and cannot do. Because the big thing is when they come in for a speech eval, um, therapist a lot of times parents thinks we can diagnose things we can't, or whatever. So, I'm here to show you what the route is for that. Okay, so just a quick disclaimer. I am a speech therapist, so I'm going to do my best to explain like what neuropsychs and neurologists and everybody can do. And a lot of this is my opinion, so take it with a grain of salt. Do your own research, and things are changing constantly. So this might be old news. It's not medical advice. This is just kind of what I've learned and observed. I'm just sharing for you, like almost as a mom to a mom or a parent to a parent. And so just take it with a grain of salt. Always consult with qualified medical professionals. So the main question I get at every evaluation, especially around the age of 3 when a kid's not talking yet, is does my child have autism? Do you think they have autism or do you think they have ADHD? This is the most common question we get. So I'm actually going to explain to you, can we diagnose that as speech therapist and occupational therapist? And then also, if not, where to get that diagnosis. So that's kind of the main reason I'm doing this because so many people don't know. And then what's the benefit of getting those diagnoses? Okay, not all professionals can diagnose everything. I talked about that. Different providers have different roles. So we have at Bayside speech therapists and occupational therapists. Occupational therapists cannot make any diagnosis. So that's why if you schedule an occupational therapy evaluation, even if it's private pay, we have to have a script from the doctor with the diagnoses. For speech, we don't have to because speech therapists can diagnose. I'll go over that in a little bit, but we can only diagnose certain things, and it usually has to do with treatment and like a therapeutic approach because of a diagnosis. So just so you know, like I thought I was confused too. I thought like an OT could diagnose sensory processing disorder or fine motor impairment. No, they can't diagnose. They can only treat. So didn't know that. So we'll go into that. So speech therapists can diagnose acceptive receptive language disorder. So they're having trouble with um they're having trouble with um just a second. They're having trouble with I'm gonna pause this for just 1 second. Sorry about that. I'm gonna come up back to this one. Um okay. So expressive receptive language disorder just says like expressive is like can they express themselves age appropriately and can they understand language appropriately? Okay, so it's telling you I can tell you, like, I can't tell you, which I think it's on here. I can't not diagnose autism and ADHD. We can't do that as speech therapists, but I can say, oh, he's having trouble paying attention and the receptive language. We can't follow directions. So we can kind of tell you the treatment or what's affecting, but not actually the reason why. And it's really important to know that difference. And I'll tell you more later. Express it, I can say, oh, they're not speaking as much, but I can't tell you the why. Apraxia, that is kind of a more deeper answer, but that diagnosis is also just highly variable. You can go to praxiakids.com. Usually there's a secondary diagnosis. So it's very rare for a kid just to have apraxia. If they have just apraxia, it's usually some genetic disorder or autism that goes along with it. It's very rare just to have apraxia alone. Phonological disorder, that means a sound, trouble saying a sound, hearing a sound, producing it. So their speech is hard to understand, or they can't say certain sounds. Feeding and swallowing disorders, and as adults, like cognitive communication issues. And I don't work with adults really that much. So that's kind of, there's probably more in that, but I'm going to start with this. Um, Different dysphasias, they do swallow studies. We can do oral, we can do it before it gets to the throat. But yes, anyways, we are really good. We can only diagnose. So things that are going to affect our treatment, if that makes sense. Not really the why. What speech therapists cannot diagnose, we cannot tell you if your child has autism or not. Don't ask us. It's going to be awkward because we can think so and we might know the answer, but unless your child's really been given the appropriate testing, we can't. Um, I've been wrong several times. So yeah, especially when they're young, when they're like 2, who knows? Who knows what they'll be like at 6 or 5? Like a lot can happen. So I try not to tell parents what I think, honestly. I send them to professionals. We cannot diagnose ADHD. We can't diagnose anxiety disorders, like things like cerebral palsy. All we can do is treat symptoms, but not diagnose these. Well, occupational therapists do, like we said, OTs do not diagnose. They treat based on doctor's diagnosis. They focus on daily functions like dressing, feeding, sensory needs, fine motor controls, being able to use a pencil. And there's something called reflex integration that helps with focus. And like basically they're all on this. I'm not an OT, so OTs, I think I got this right. So an occupational therapist and occupational therapy is like, as an adult, if you go to occupational therapy, it's a lot what's going to help you with your activities of daily living, or what your profession is, like helps you get back to your occupation. And a kid's occupation is playing and going to school. So they're going to do things to help function. If it's being able to sit in a chair to learn, if it's going to be holding a pencil right, dressing, feeding, all those things just to help them with daily living. So they're thinking more of function more than diagnosis. And tell me if I'm wrong, OTs. You can write a comment. But that's what I have understood, and that's what I've seen. The difference with not diagnosing, but still treating the symptoms. Why this matters: SLPs diagnose or treatment based, like how we can help for treatment. They describe what we can work on. They do not explain the root cause. And I think that's so important. Everybody, that like when you come to a speech therapist, we can give a diagnosis of one of our diagnoses, but we cannot diagnose the root cause. And 95% of the time, there's a root cause for a speech disorder, a feeding disorder, an expressive receptive language. All those things, there's a root cause. And if we don't get to that root cause, a lot of times the surface things don't get better, or we find other symptoms from the root that might not be speech, but something else. So I do think if you are coming to us for speech and language, we're going to refer you to another professional more than likely, because we really believe in treating the root causes. For an example, if your child comes to us, and this might be on here, let me see here, the why I'm at this. Here it goes. If your child comes to us and they're not sounding correct, but they haven't had their hearing checked and they have hearing loss, well, no matter how long I work on speech sounds, they're not hearing correct, so their speech isn't going to get better. So why do I continue to see this patient? Like, we have to look at what's causing a lot of this. And since we can't diagnose or do the testing, we have to refer out a lot. So usually our initial evals do recommend other professionals. Enlarged adenoids a lot of times cause sleep issues. They're so common. And so if you're not sleeping well, guess what's going to happen to your attention? It's not going to be good. Like think about when you don't sleep well and your mouth is open. Like when you've had a cold before and you slept through the night with your mouth open. How did you feel the next morning? Probably not rested. That's how your kids feel all the time. It's really important that we treat that because it can affect speech and it can affect feeding, but it also can affect sleep and their palate and development. So getting to the root cause can also help future issues and how your face develops. Like we're not treating how your face develops, but we are treating the speech part, but getting the underlying root will help future problems, if that makes sense. So at Bayside, we really try to understand, refer out to figure out the why. Treating without the cause limits progress. An autism diagnosis, who can diagnose? A developmental pediatrician is who I recommend. There are 3 right now. Like I said, this is updated. I'm not sure when it will be updated when you're watching this, but in March 2026, there is Dr. Baker at Pediatric Healthcare Alliance, but you have to be a Pediatric Healthcare Alliance patient to see him. He's within their network. There's Dr. Shulkin, and I think there's another doctor now at All Children's. And there's Dr. Oh my goodness. I'm gonna put it in the chat. But there's another doctor, and he's new, and he doesn't have as long as a wait list. Adam Juliet, and he's in network with insurance. All 3 of those doctors also take insurance, Medicaid, everything. And just like 6 months to a year to get in. So they are doctors, MD doctors who study developmental issues. Like this is what they do. So I recommend them, number 1, to diagnose autism and even ADHD, to tell you the truth. A neuropsychologist is great. They usually can get in quicker with them. Most of them don't take insurance. It's about $2,000 to $3,000, and they're going to give you a long, long test. Oh, I think I'm going to go over this in other slides, but they're going to give you lots and lots of testing. And then last, the neurologist. Let me see here. Okay, no. So I'll tell you real fast. Neurologist. A neurologist is going to do there's something called the ADOS testing. Is sometimes it's autism testing, and standardized test. It's kind of the gold standard for autism testing. Some of them do that, and some of them don't. They can give a diagnosis without doing any testing. They can. Like neurologists can do whatever they want. So um, it's finding a good neurologist. They're kind of my least favorite, honestly, to give diagnoses. Okay, see, diagnoses. Um, but sometimes you have to go where your insurance is. And I'm sure there's some great ones. I just know that a lot of times that's not what their specialty is. Like their specialties are more like seizures and other brain things. Like it's just not what they went to school for. And I just have found that that's like not their passion. Where a developmental pediatrician, that's kind of their passion and what they went to school and did their training for. Neuropsychologists are okay, but they're not like MD doctors either. And I think sometimes they miss things like genetic testing because the developmental pediatrician is going to rule out genetics and other things that maybe a neuropsychologist won't. So yeah, really, really, really think that would be the best. Autism testing, the ADOS testing I told you about is the most important thing, especially for neuropsychologists. So they do their own ADOS usually, but then they usually give like parents and teachers the scores. And sometimes that's all very subjective. So if I think my kid's fine and the teacher thinks the kid's really severe, those are going to contradict each other. And the neuropsychologist is going to have a really difficult time deciding what's truly going on because there's different perspectives. So I wouldn't say this is again why I don't love the neuropsychologist for autism testing. Um, yeah, that's what I have to say about that. And then also, yeah, even ADOS can be subjective too. A lot of these testings can be subjective. Like you could take your kid to one place and they'll say especially the neuropsych and the neurologist, they don't have autism, and then the other one will say they do. Where I feel like developmental pediatricians, I've had solid results there, where I feel like they're pretty accurate. Diagnoses can vary between providers. Like I said, autism criteria is very broad. I honestly feel like it got to the point where everybody was getting diagnosed, and I think it started to get reined in where we're seeing a more clearer picture of what that truly is like to have autism. Because there's a lot of things that could be commingled in there. So, like I said, getting different opinions isn't a bad idea either. If you don't agree, you can always get a second opinion. Um, but the main reason to get a diagnosis is usually for insurance funding, because you're going to love your child and treat your child the best way, possible, no matter what they're like. So it's really just for insurance funding, especially for these diagnoses that don't have like a blood test or an x-ray. It is kind of a subjective diagnosis. It is. Um, yeah. So ADHD diagnoses, again, pediatricians. So your pediatrician can. I know most won't do it after 6 because before then, most all kids kind of have trouble paying attention. If you give them the test, almost everybody will get diagnosed. So they usually like to wait till after 6. Psychiatrist, developmental pediatrician, neurologist, they can all also diagnose ADHD. So the speech language pathologist, this is where we get expressive receptive language. This is our challenge because your child, a lot of times kids will have good expressive language. So like it'll be like 95. But receptive language is like 65. So it's very or lower than that, which makes no sense because you can't be able to say more than you understand. Like, and it's really because the ADHD is preventing you from following the directions in those tests. So it's not like a true language delay because you just had trouble paying attention to the questions. That's what I'm saying. If I don't understand that, I can't treat receptive language of following directions if you can't follow directions because you have an ADHD diagnosis. That's why the root cause is so important. Um, about testing, many evaluations. Okay, so we already talked about this, so good for that. A neuropsych eval, 2 to 3 thousand, where and it may or not be covered by insurance. So you know that, but most like developmental pediatricians and neurologists are covered throughout insurance, and some neuropsychs are. I think about ABA. There's a lot of reasons that people want diagnoses. I'm sorry if you hear my dog barking. Is is because they want the autism diagnoses because they can get ABA covered. And most ABA clinics won't take you unless you have an autism diagnosis if you're using insurance. And again, you can correct me if I'm wrong. And this has been my personal experience over the years. Like I've heard an ABA clinic saying ADHD was okay, but then I've actually never seen anybody qualify and be seen for with an ABA with an ADHD diagnosis. So that's why a lot of people want the autism diagnosis is because they can get ABA. I said we talked about this before. The things that we miss when we give diagnoses, like not doing a hearing test, like if a child's not hearing, ignoring medical issues like adenoids, and relying on labels instead of the root cause. Kind of covered. Our approach at Bayside is I'm sorry that the dog's okay. And our approach at Bayside is that we want to look beyond the label because every kid is so different. And a lot of times these diagnoses aren't even like correct because they can be so subjective, right? So really treating what's going on with the kiddo and like meeting them where they're at and where the family's at. And also looking for those root causes and referring out to appropriate specialists because we want to make sure if you're a lot of time we're the first stop a pediatrician will send a child to. If they're not talking at 2, they'll send it to us. But if this child cannot sit down for 5 minutes to do anything, how am I supposed to work on speech and language? This child really needs like OT to regulate their body first, and then they can be able to work on communication. But it just happens that we're like the first stop for pediatricians to send them to us, and then we have to walk through this. We get to walk through this journey with you. But that's why we do refer out because usually there is something else that we can kind of uncover. What we want parents to know, a diagnosis can be help with services and insurance coverage. That does happen. It does not fully define your child. Understanding the whole picture matters most. So, like I said, I want to continue doing these not podcasts, but just YouTube parent meetings. If you guys, I'll advertise more for next week, next month, so I can have parents come and ask questions because I think that's really beneficial. And last month was schools and funding, so go ahead and look at that. And I kind of want to hear from you guys, like, what do you want else to be covered that I'm not covering? So, yeah. All right. Our mission at Bayside is to be honest, we're real and authentic, um, helping families thrive in the community and supporting children with the right care. So we just really are a very honest company. We try to do what's right, but we are a small company and we need you to show up to your appointments. And because we want to help the community, but it's also small business. But I also feel like my mission with this company is to help like I said, the families in Pasco and Pinellas County really just be equipped better because when you get a child, there's no manual and there's a lot of learning as you go. And if I can help just answer the questions that I'm asked every day, then I've helped and I feel like we've done what we can. So on our mission to help our community and families. So that is all. Thank you so much for watching. And please email me at Nicole at Bayside Therapy Specialists if you have any questions. Apologize for the dogs. And apologize if I um, didn't always have the right words to say. It's the end of a long day. And I'm working on all that. But I told you I did have expressive language disorder when I was a kid. Had an IEP through high school. But I have my master's degree and I own my own business. So no matter what your kid is going through, they're going to be fine. So we'll get through it. So thank you. Have a great night.